Good Wednesday morning, everybody. It is Dr. Sanders here with Western Healthcare Exposed, and today we're going to talk about pain management. I'm going to do two videos, one on traditional pain management and one on more alternative things. I've got a set of notes so I don't forget anything. If you see me looking down, that's what I'm looking at. And so we're going to get started with what you might be offered if you go into your primary care office as far as what the traditional treatment of pain would be, and this is for acute or chronic pain. So to start with, your traditional medications, you may be offered NSAIDs, that's nonsteroidal anti-inflammatory drugs. These are things like Advil, things like Indocin and Voltaren and Celebrex, Toradol. These come in creams, capsules, injectables in the case of Toradol, and tablets. And they are helpful. They help pain and inflammation. They are meant to be used short term. They're not meant to be used for months or lifelong. They do have side effects, things like gastritis. They can cause ulcers and worsen GERD, and they also have nephrotoxic properties. That means they can harm your kidneys, cause things like interstitial nephritis, something you do not want. So again, these things are okay, not to be used lifelong or even probably for months at a time due to the side effects. Next, you can be offered opiates. These are your things like Vicodin, Lortab, Percocet, oxycodone, OxyContin, morphine, dilaudid fentanyl, things like that. These are okay, I think, short term if you've had a car wreck or a broken bone or teeth pulled. Unfortunately, in America, we have started using these things lifelong. We have many patients that are on these forever. It's like the doctors think that patients have a Percocet shortage in their body. You do not want to be on these lifelong. They are super addictive. They have, like I said, addictive properties, and you don't know how many Percocets you have to take before you become addicted. You don't know if you have a genetic predisposition to addiction. So take these as sparingly as possible, and certainly do not take them lifelong. They are good for acute pain for a few days. Chronic pain, as we discussed in other videos, they actually worsen chronic pain. So why you would take these for months and years, I don't know. I'm sure many of you that may be on these lifelong notice that you take them and then all of a sudden they're not working. You go into your doctor and your dose gets escalated, and then you go back and your dose goes up again and up and up, and maybe change medications or add medications, and your pain never gets better. That's because they worsen chronic pain. They do not help with that. So do not take them lifelong. Next, you could be offered one of the antidepressant medications, something like an SSRI, a selective serotonin reuptake inhibitor. That's your Prozac, Zoloft, Paxil, Wellbutrin, Effexor, something like that. Or you could be offered a tricyclic, something like amitriptyline. These are good for certain types of pain, I guess. I am not a fan of these drugs either for pain or for anxiety or depression. We have a lot of patients come in and want off these drugs, and their two main complaints are, I feel dumb, and they say they have no emotions at all. And that's because these drugs alter your neurotransmitters in your brain, and that's what causes these side effects. In addition, they can cause cardiac side effects. You can have arrhythmias. They can drop your sodium. That can be very dangerous. That could cause seizures. They can worsen depression. They can cause worsening suicidal ideations if you have those, and they can cause serotonin syndrome, and that's just the more serious ones, not to mention all the other milder side effects, if you want to call side effects mild. So I'm not a fan of these medications for anything. Next, you could be offered muscle relaxers. These are things like Flexeril and Norflex, Robaxin, Soma. These are pretty good to use for short-term issues like sprains or strains. We use those a fair amount, and they do help some. You can get those in pills, injectable, IV. We do all those here in the office. And lastly, you could be offered a drug that alters neurotransmitter release differently than what the SSRIs do, and these are things like Neurontin and Lyrica. These are a favorite. They are FDA approved for diabetic neuropathy and seizures. I am not a fan of the FDA, and the only reason something is FDA approved is because they say it is. And But still, you do not want to be taking these for other issues like chronic pain. They are not meant for chronic pain, and they are super addictive. Things I guess we didn't realize back 10, 15, 20 years ago how addictive they were, but I think, at least in my experience, they are as addictive as Percocet or OxyContin or meth or anything else. We have a huge problem of this in our area, and these drugs are no good. They can have side effects and cause things like rhabdomyolysis. That's a muscle breakdown problem. They can worsen depression, worsen suicide, cause angioedema. They can cause seizures. Even though they used to treat seizures, they can also cause seizures, especially if you abruptly stop them. That is something you do not want to do, and you need to taper down on these if you are on them. And so anyway, that's, I guess, all the traditional medications you might be offered if you go into an office. Now, you may be offered some different modalities, things like physical therapy or occupational therapy. Physical therapy is good for acute problems, good for joint replacements and things like that. I have not had good results with chronic pain, like chronic low back pain. Unfortunately, insurance companies require you to go to therapy before they will approve an MRI. This basically just, from what I can tell, waste 6 weeks of a patient's time getting to the bottom of what's wrong because they have to go to therapy, which inevitably does not help a chronic problem. That's not to say I don't use physical therapy. We do. I like therapy. I just don't think it's good for chronic pain. Next, you could be offered a TENS unit. This does help sometime, especially for more acute issues. These are electrodes that go in your muscles that will put some electricity through them that can stimulate healing. We use that at times. Ultrasound therapy, something else you could be offered. This does help. This is a probe that you rub on the injured muscle, and ultrasound waves go very deep into the muscle and stimulate healing. Lastly, you could be sent to a pain management physician, and maybe they're an interventional pain management physician, and they can do other things aside from managing your pain medications. They can do things like injections. They can do spine injections, epidurals, facet injections, other joints, SI joint, things like that. And these can be helpful at times. And they can potentially, as a last resort, do a nerve ablation where they just completely destroy the nerve that is causing your pain. And these can be helpful as well. Anyway, that's about what I have down for the traditional therapy that you could be offered and what to watch out for. I hope you found this video helpful and informative. If you have questions or comments, leave them below, and stay tuned for the next video as I will be doing the alternative forms of therapy. So thanks for watching, and I will see you later.